Hello and welcome to Color Commentary. Today I'm joined by my friend Monica Chung. When I think of Monica, I always think of the third of four Chung sisters, the life of any party or crowd with a vibrant spirit who loves good food, good wine, and good adventure. We've gotten to connect over the years, but one area I realized I've never gotten to talk in depth with Monica, or should I say Dr. Monica Chung with, is on her long and successful medical journey. She completed her residency training at University of Texas Southwestern in Dallas and is currently training as a reproductive endocrinology and infertility, aka REI specialist to gain experience in the diagnosis and treatment of infertility. She's doing that here in Houston, which is how we got to reconnect, and I'm super excited to have this conversation today. So without further ado, Monica. Hi.
Hi, Angie. Thanks for having me.
Thanks for agreeing to come on and share your story. I met Monica through church, I guess.
Yeah, I would say kind of through church. I think my parents, when they originally immigrated from Korea, they lived in Houston, Texas.
Oh, I didn't know that.
Yeah.
Okay.
And so they actually, when my dad was there, he was friends with a mutual friend of your guys' dad, Paul Song's dad.
Oh, okay. I didn't know any of that.
And then so when we moved from Oregon to Texas, my father and Paul Song's dad, they rekindled the relationship. And then when we, like my family, flew and met up with them, that's how we were introduced to your family. And then now, our parents are now friends.
Yeah, very
like,
good.
Independently, and hang out on their own.
Oh, I didn't know Paul was the
his
connecting factor.
His parents.
Oh, and how did they meet? Just through schooling?
I think they met through church. When they were in Houston, yes. Because my dad was a medical student
and he was
at Baylor.
dental or what?
Yes.
I'm assuming he would have been dental.
Yeah, I think he was in, we'll have to ask Paul.
Yeah.
But I think he was, doing some training here in Houston.
Interesting. And so, I remember us meeting at maybe your house where it was like a lot of daughters.
No, I think it was
it was not my house. Maybe it was
Paul's. I think it was Paul's house. I think it was Paul's house.
Okay. Yeah, I don't remember what his house looks like right now. But it's probably not yours either because we probably connected that day.
Yeah.
And then you guys were all sisters. I was like, oh my gosh, like so many sisters. But I think it was only you. Was it you, Tiffany, and Elizabeth? But Amy never came.
Amy was, I think, in Austin.
Already in college.
Yeah, she was in college at UT Austin.
Oh, got it. And so then we met then, but then I feel like you guys disappeared because you went back to Oregon?
Yes.
Okay.
So during that time, we visited, went back to Oregon, and then about, I think 6 months to a year later, we decided to finally make the move to Texas. And I can go, there were some delays in like our moving and things like that, where I stayed back in Oregon for a year on my own after my parents had moved to Texas. And so I lived with, our good family friend. And then I moved after I graduated high school.
And then you went to Baylor straight away. Interesting. Okay, I have a lot of questions on our personal connections that I didn't realize the details to. But you're here because I wanted to hear you share your story on the journey to becoming MD and all the kind of crazy accomplishments you have achieved throughout that time. And I don't think I've ever really heard you, not like humble brag about it, but like whenever we did connect or hang out, it was always just about like what's happening in our lives or like personal things or like just having fun. And I'd never thought to realize, like Monica's doing like med school schooling right now. And then she's also doing residency. And then now like you're doing fellowship.
Yes. Yeah.
So I would love to just kind of hear how you embarked on that journey. I feel like that's a big decision to make.
Yeah.
And I don't know, like, since this is a focus with like, our Korean American community as well, I was wondering like if being Korean or if that identity also played a part in this decision, or if not, like what other factors kind of led you there?
I mean, I think certainly being, I think I had a heavy influence from my parents, whether them or me being Korean American had any influence that I'm not sure. But definitely, my parents immigrating here from Korea at a younger age, like in their teens. And then my father getting training in medicine and being a physician, that definitely, I think, opened doors early on and really kind of gave me that exposure early on that I knew that could be a possibility for me in the future. We would just visit him like in the hospital and at his work. And then, so when I was younger, I thought I wanted to be a doctor. And then,
because you want to be like your dad.
Yeah, exactly. And then kind of as I got older, like in middle school and high school, I was more influenced, I think, with my friends and maybe flirted with the idea of potentially going into business or in another direction. But then when I was in high school, when I was 16 in my junior year, my mom was diagnosed with stomach cancer. And so, and stomach cancer is not common in the United States. It's a pretty common cancer in Asian countries like Japan, Korea, and China, but it's pretty rare in the United States. And so that's why we decided to stay back in Oregon a year. Our move was delayed a year later because of her diagnosis, and then just finding like the best surgeons, and then she had to undergo chemotherapy and radiation. So I definitely think that exposure, me being, I was essentially her primary caretaker at that time. I definitely think it revealed my strengths of, being able to be empathetic, having that caregiving side. I think that definitely emphasized my strengths and qualities of being potentially a good doctor. And then also I think being like my strengths in school were always like math and science and things like that. I was never really great at like liberal arts, writing or history. And so I think that, you typically go towards what you're good at naturally. So I think that definitely also played a role.
So then was when your parents did move to Texas, she had successfully gotten better? Yes.
So when we were in Oregon, she got surgery. So basically she got what was essentially like when people do get bariatric surgery to lose weight, that is essentially what she did, but it was out of obviously necessity. So she had a very, very small portion of her stomach remaining. And then shortly after, she underwent like very intensive chemotherapy and radiation. So it was, your stomach plays a huge role because your ability to eat and absorb nutrients and food. So she was pretty, even after all of that treatment for many years, I think it played a huge significant role in her body. And even she's in remission now and has been in remission from her stomach cancer, but still it can, it does affect her because her stomach is still not the same as it was before her cancer.
I think Matt's mom, I'm pretty sure it was also stomach cancer that she had because, and I just wonder like a connection even with his sister who is a bariatric surgeon today too. And just hearing your story just kind of made me think of that. But I don't know if there would be a link.
I didn't know she was a bariatric surgeon.
Yeah. Is that the GI, MIS, any of those?
Yes.
Minimally invasive.
Yes.
And then you specialize in the bariatric
surgery. Yeah, I think you can go.
My in-laws are all
I think you
doctor.
I think you can go like GI route, and you can do some bariatric surgery that way, and then you can also go like the general surgery, like onco surgery. That
I think
route
she's
as well.
on the special. Well, yeah, because
Like
she did
the GI. She did like a GI fellowship.
Yeah.
Okay.
They were like somewhere cold for like 1 or 2 years for the fellowship.
Okay. Yeah, she probably does those type of but for cancer patients, it's a little bit different because especially if your staging is more advanced, they want to resect all of the cancer, including your lymph nodes. So you have to have a surgeon that specializes in like removing all those lymph nodes chains like right next to large vessels.
I also like never talked about like smart sounding. Like I just always we always have fun. I feel like I'm like learning all these stuff. I'm like, oh my god.
There's just like a lot of nuances and specific information that we've just never talked about.
Yeah. Okay. I like this. Well, okay. I thank you for sharing that. And I feel like I've always heard about your mom going through cancer, or like recovering, and I'm glad that she has had a good recovery overall.
Yes. We were very, very blessed. Yeah, definitely.
Okay, so then with that being a big part and like getting to see your dad also practice, which I think would be so cool growing up, like what did that journey look like for you, where you became or you got accepted into med school and then started this very, very long journey?
Yeah, so I definitely think, a lot of Asian American parents, their quote dream is for their children to like
you've done the dream.
go into medicine or something, or go to an Ivy League school, just be successful, because they obviously have sacrificed a lot.
Right.
My mom was both my parents were always supportive in whatever I wanted to do. And honestly, I think for all my sisters and I, not that they didn't have high expectations, but I think that they didn't really know what to expect. And so they never really anticipated that any of us would go into healthcare.
Which you all did.
Yeah,
wow,
exactly. Okay. And my father, he actually, he, I think, had some reservations about any of us going into medicine. And especially when I was talking to him about potentially applying to medical school, I think he did have some reservations, because when he was training, there were no duty hours. So he was working 100 plus hours. My mom would hardly see him. And so I think he was really concerned about that work-life balance. And when I was ready to start a family, I think that was one of his main concerns. And so when I initially made that decision, obviously both of my parents were very supportive. My journey started in college, obviously. I feel blessed because I knew pretty early on in college that I wanted to go into medical school. And so I knew, as much as I did at that time, how the sacrifices and what it takes to get there. Specifically, I think grades, extracurricular activities, and then your MCAT, or like your board score before applying to your exam entrance score before going into medical school. And I had two older sisters who were already in college, and so they would always talk about how kind of a culture shock starting college was. And so I think I kind of anticipated that it was going to be difficult. And so knowing that, I think I kind of just wanted to be successful and get good grades at the beginning. So yeah, all throughout college, obviously just trying to focus on my grades and shadowing opportunities, doing research, getting immersed in like volunteering and extracurricular activities, and then eventually applying to medical school and getting accepted. And that was a 4-year journey. And I did that. I went to medical school at Texas Tech in El Paso. That was definitely also a culture shock. Just being
location
so far west. But I loved it. It was a newer medical school, and it was on the border, obviously, of Mexico, Juarez, Mexico. And so we saw a lot of lower socioeconomic status patients. That patient population ended up being really similar to the patient population that I had when I was in residency at UT Southwestern Parkland, Dallas.
Okay.
And that's what really interested me in pursuing my residency at Parkland. Like, they call the hospital in El Paso like a mini Parkland.
Wow, so that really set you up for what you kind of wanted to go into after.
Exactly. So I did 4 years of medical school in El Paso, then 4 years of residency in Dallas, and then I am finishing my second year out of 3 years of fellowship here in Houston.
So that's like 4 plus 4 plus 4 plus 3?
11.
11.
4
11
plus
post-grad.
11
plus
years
4,
of postgraduate
15.
training.
Wow, you've done 15 out of high school. Like, if you include Baylor in there, that's a lot of... Because people just have like 4 years of school.
If that. Yeah, because not
But
everyone.
11 like medical training years.
Yes.
Wow.
It's definitely been a long journey. I'm definitely ready to start working.
Were there moments within that journey where like you thought about quitting?
That's a really good question. I've actually never thought about quitting. And I think probably the most likely time for most people is during residency, just because the training and the hours are so vigorous, and it's something that's completely different than what we've ever experienced. We're used to studying and, if we test well and if we do well on exams, then we find our fulfillment in that. But in residency, you're really working and seeing patients. And if you have a bad outcome or a bad interaction with like a patient or one of your colleagues, that's completely different than anything you've ever done. So I've actually never thought about quitting. I would say, I think One of the most difficult times for me was actually in college when I was taking my MCAT. I am definitely more of a social person, and
You're a very good social person. Yeah.
Yeah, and I definitely prefer to, I think that's why I love clinical medicine so much, because really the highlight is, talking to my patients and treating them and managing patients. And so I think really just, studying all day, every day, especially like in the summers when all my friends are, hanging out. That was, I think, a huge, and I was still pretty young. I was, I think, how old was I? Like 21? Yeah, I guess like 21 when I was like studying for the MCAT. So I think at that point in my life, it felt like a lot, like a huge sacrifice. Like, am I willing to do this? But retrospectively, it obviously paid off. But that was, I would say one of the most difficult times in my life.
I don't know. Like, I feel like that would just be very isolating.
It was, yeah. I would like go to the, my sister was in dental school, thankfully. And so she would go to the library and study. I felt really lucky because I would go to the library with her and her friends. And I actually, I would have some people to study with. But like when she would go on summer break, really there was nobody. It was, it was a little bit depressing, like going to the library and forcing myself to like study in a cubicle like 8 hours a day by myself. So
well, you did it.
Yeah,
good job.
I know.
I guess like one side question I had from when you were sharing was just, it sounds like your family is very good at communicating. Like your dad sharing his reservations. Because even like Jaden for his tour, which is like the 1 year for Korean, and they're like, you pick an item and he picked the stethoscope, and I like freaked out, and I don't know why, but I just like, I think as a significant other watching that journey has been so stressful to like, it's just a lot, and like, so I think like someone who's lived it like your dad, like to share his reservations or just like clearly let you know like what are things that could be difficult, and then like your sister is sharing with you like what the culture shock looks like in college. Like I feel like those are conversations I don't think are normal in Korean families. Do you guys have a good standard for communication or like healthy communication, or is it just like emotions back and forth with that?
I definitely do feel blessed. I think my family, just naturally, we are very close. I mean, our family is not without strained relationships in the past. Obviously, growing up with three sisters and us three older ones being, really Tiffany and I are only 11 months apart, and then her and Amy are only like 16 months apart. So,
which your mom had y'all in residency,
when
right?
My dad was in residency.
Like when I hear that story now, I'm just like, oh my gosh, your mom is like
my
a superwoman.
Mom. I know,
and also your poor mom.
Yeah, and she was, and then she also taught
especially
piano.
when duty hours weren't a thing.
Exactly. So he would like. My mom said that he would come home from work like late at night. They'd be eating dinner, and my dad would literally fall asleep while he was eating.
He's
just,
so
like,
tired too.
Yes, he was just like exhausted. But she also was exhausted too.
I know that's so hard.
Yeah, exactly. And
she was a piano teacher.
Yes,
I didn't know that.
So she was a piano teacher. I think when we were a little bit older, probably like in elementary school, but even then she would teach piano at home, and she was a piano teacher, but still technically a stay-at-home mom because she didn't have a nanny or anyone to watch us. So if we were fighting or if we had like an emergency or some sort of extracurricular activity we had to go through to, she would have to fit all of that in between all of her students. Yeah, so I definitely think, both my parents have made a lot of sacrifices. And I think, I would say my sisters and I are more Americanized, and I think so. When my oldest sister Amy was young, she only spoke Korean.
Oh, okay.
And so when she went to preschool, she didn't speak at all because she didn't know how to communicate with others, and she was also pretty shy. And so I think that concerned my parents a little bit, and so since that time they started speaking English to her. And I think that's how the trend where my parents and I, the children, speak English to them, that's kind of where it stems from. I can read and write Korean because I went to Korean school when I was younger. But I can't speak Korean fluently. I think my parents want us to learn Korean, but I do feel blessed that I can communicate with my parents freely in one language. My parents, I think, have a really good understanding of, our culture, like being in the American culture. And we just all naturally like communicate well with each other. Like my sisters and I are all very close, and we obviously have a family group text. And so we talk on that. And yeah, my parents are just good at communicating with us.
Because if I'm thinking she's trying to parent you guys while she's also working, but I always hear like sisters like now are like the best friends ever. But if you're like close in age, like I'm sure there's like just way more fighting than, you know, like when you're younger, I feel like I only hear of like the ones that are like close sisters, like, but we're close now, but back in the day it was like terrible or something.
So Tiffany and I fought the most because Elizabeth is 6 years younger than me. So we were kind of in a different stage in life.
Right.
And it was hard for me because being the third, I always had to share a room with someone. Amy would always get her own room, and then Tiffany and I always shared until, you know, we moved, and then when Elizabeth was there, I had to share with her. So
and that's like a huge age difference.
Yes. So I remember I was like, I think I was in middle school when she was in elementary school, and I've always been a little bit like OCD about cleanliness, and she's like, you know, she's young, so she's like playing with her Barbies, but I remember I would get like so upset with her, like her Barbies and her toys being everywhere. But we've definitely come a long way. But yeah, I've definitely,
now you guys are the ones in Houston together.
Yeah, I know, but I've definitely learned how to share. So
okay, thanks for going on tangent with me. Okay, so if we're going back to like, the way that you were able to navigate through med school and then residency and now fellowship, I guess one of the questions I would be curious to know a little bit more about would just be like, since you are a woman and specifically an Asian American woman, kind of like if you would be comfortable sharing any problems or issues that might have arose due to that part of your identity?
You know, personally, I've never felt discriminated against in like since I've been in this profession. You know, definitely living in Oregon, Asians, the community that I lived in, Asians were definitely the minority. And everyone that I went to school with, they were either white, majority were white, and then some Hispanics. But my sisters and I, and then maybe there were like a handful of other Asians in like a graduating class of like 600-700. So I think growing up, you know, in a predominantly non-Asian community, I definitely experienced not discrimination, but, you know, just comments and things that people would say, not intentionally, I don't think, but that were a little bit offensive. But, you know, since being in college and medical school and residency, I really haven't had like no discrimination for being a woman or being Asian around like my colleagues or my attendings. Occasionally, with patients, occasionally I have. You know, I look younger than my age, and so a lot of them don't necessarily think yes, like have reservations. Like a lot of them think that I'm like I've gotten like that I look like I'm in high school. Or
do you watch Friends?
No.
Oh, there's this episode where Phoebe, she's delivering and they send a young looking resident to like to help deliver, and then she like not cusses him off, but it was like, oh, you need to go. It just made me think of that. That's like an example of what you might have been like.
Well, and even sometimes I think men in OBGYN residency is a minority.
Right. That's
so
true.
Yeah, maybe there's like 10% male. And so, you know, a lot of the female residents, and I would say that some individuals like show favoritism towards them. Like we felt like sometimes they could, get away with more. I don't know if that was necessarily true or not. Right. Yeah, sometimes we did experience that.
Do you think being in this field helps with being a woman, or do you think in general this field has gotten more progressive in not being discriminatory, if that makes sense?
Yes, that does make sense. I think that our community and our society is definitely, you know, trying to provide like gender equality, and especially I think in medicine, I think they are really trying to do that just by, I don't know exactly if they've nationally like taken any steps like mandatory, like
right,
but there are certainly like a lot of surgical subspecialties where women certainly are the minority. So like I think neurosurgery, for example, it's a 7-year residency, and there just aren't very many women in the subspecialty for whatever reason. But I think definitely being a Korean American female in medicine, like I definitely feel like I have a responsibility to, I think, just like representing my culture, and then also representing being a woman, and showing that you can have, you know, you can experience work-life balance and be genuinely happy and genuinely passionate about what you're doing. You know, I think a lot of people, sometimes, you know, people will generalize and think that, you know, my parents, quote, made me go into this this field. And they think, you know, they don't necessarily know if I'm happy, but yeah, I truly do love what I'm doing. And I don't think, and I think that's really, really important. I think you know, need to love what you're doing every day. And then also outside of work, I think not making medicine your identity, but also finding happiness in other things that you're doing.
Yeah, I feel like you represent the things you said you wanted to represent well, right? Because like I think there are people who make this everything for them, you know, and like while it is definitely a huge part of who you are and where you've spent the last 11 plus years, right, of your life, the fact that you also show that other side, that you're saying like passion about other things in life, I think that's all I ever thought about when I thought of you, even though I should also think about the MD too, you know, but like I think that's because you also did that well, like showed that work-life balance. Do you have specific things you do to make sure that you have that work-life balance? Because this is like a really demanding field and like a demanding specialty, and now even this next step, right? And so I'm just curious how that works for you, because on the outside it seems like you carry a great social life and connect with all your relationships, you know, so it's like, oh my gosh, how does she do it all? And now that I know what it takes to be in this kind of journey, it's not easy at all, time consuming, and I just want to know how you do it and how you could advise younger women to do that.
I definitely think, you know, it is also part of my personality and my nature. I think I am more extroverted, and I find enjoyment and fulfillment in relationships, whether it be at work and outside of work. And so, you know, I think a huge influence has really been my family.
Okay.
My father, you know, he was a physician and works a lot, but he always prioritized his family and his faith. My family were Christian, and so his relationship with God, he always has put that focus on his purpose in life and why he's doing this. And so I think that really throughout my journey in becoming a doctor has really kept me grounded. But I think, I do think that a lot of times, you know, in different journeys and stages of my life, you know, in residency, for example, I was working 80 to 100 hours a week.
Oh my gosh.
And I chose that, you know, depending on what subspecialty you go into, I think it's important to find training, like a residency training program that really suits your personality and your needs. So, you know, being at Parkland, it's the biggest OBGYN residency in the nation. So we take 18 residents a year, and so that's 72 residents total. Typically, most OBGYN residencies, they take maybe about 5 a year. And so it's much bigger. But what I really loved about being there was I just got along with everyone that I worked with. I've made some of like my closest and dearest friends like in residency. And so we always made an effort at work to just really enjoy what we were doing. And, you know, I think just always constantly having a positive outlook and a mindset in everything you do, because it's really easy to become negative and get bogged down. And I think that if that can become a habit, and then it's just a mental habit, and you kind of just go in a downward spiral. And so even like after like we would be working like a 14, 16-hour shift, and we would all still like go out and like get a drink together, or like do happy hour, or like go to each other's places and talk about like the day and just enjoy each other's company. So I think you really, like for me, that's important. I think you have to find what's important to you and what works for you. And so I think I've always prioritized, you know, spending time with family, friends, and obviously I love eating. I like drinking wine. I really enjoy exercising. So those have all been really great outlets to relieve stress and find that work-life balance.
I was reading on ESTP, the Myers-Briggs, and thank you for taking it after.
Oh yeah, I took it.
It's the entrepreneur, and like you're very good at being in the moment and living in the moment and being able to like bring that alive, or like obviously also like super attractive, charismatic people and things like that. But I think that's really helpful as I'm listening, because it just sounds like you choose to live life in the present with residency too. Because I know like sometimes like people can like, okay, once this is done, then I can do my life after. But it's like that choice to make that a part of your life and let that be your community makes it not that much. I mean, it's still a 16-hour shift, but then it's like your community. And so you're living life with people. And I feel like that's so important and something a lot of residents feel like they're missing.
Yeah. And I think just in general, like not just in medicine, but to always remember, like I always try and remind myself, I will never be in this exact situation in my life ever again. So, being in residency, working those long hours, or like being in like a really long surgical case, like an 8-hour surgical case, like, yes, that's physically like exhausting, but all these experiences are making me a better clinician and a better person. And also I will never be in this same situation. So when I moved to Houston, I wanted to stay in Texas.
Okay.
And they have a resident or a fellowship program at UT Southwestern, but I wanted to do my post-residency training at a different institution. And then also that UT Southwestern was going through some changes in their fellowship as well. And so that's how I ended up here at Baylor. I like growing up, and then even after college, like I've moved around about like every 3 to 4 years. And so I've been able to adapt. But at the same time, I built my life in Dallas, and I was very comfortable there. So I think, moving to Houston, while it's only like 4 hours away from Dallas, it still was difficult for me. And then being in fellowship, I think it's a much smaller, fellowship is a much smaller community. Yeah. So when I had, like 71 other co-residents in my fellowship now, there are only 6 of us total. So going from like 72 to 5, and you don't see them on a daily basis. You're not really working with them. You're mostly working directly with your attending. And so that also was a huge change. But, I definitely appreciate getting that more one-on-one time with the attending, and now seeing like these infertility patients and pursuing this career that I've been wanting to pursue my entire life. And then having, never in my life, I'm never going to be able to have this training ever again. And so I'm just trying to take advantage of that.
Yeah. Okay, let's talk about this training then. What led you to choosing, well, I guess your specialty, but then ultimately to this part with the fellowship in REI? When was that moment like, oh my God, this is what I want to do, and then leading up to here?
Yeah, that's a really great question. So I chose OBGYN because I really loved the focus on women's health and building that relationship and really being involved in someone's life at a critical time in their lives, like getting pregnant, being with them through their pregnancy, ultimately delivering their baby, and having that kind of like lifelong relationship. Yeah. And then also because it is a very procedural and surgically heavy specialty. I realized that I really loved being in the operating room and operating in medical school. And then actually when I was in medical school, I did an REI away rotation at a hospital in upstate New York. And so that was really my first exposure to REI. And I had never experienced it before, but I think it's not just the women, you're treating and evaluating the couple as a whole. And so being able to build and establish that relationship with the couple, and, being a part of this critical time in their lives and being able to provide options where they otherwise would have never had. Yeah. It's just like, it's very, very special. And then also, REI, IVF, it's a very fast evolving field. It's very basic science and clinically research heavy. And so there's just so much room for expansion. There's so much more that we can do now than we could do 10 years ago. Yeah. But there's also so much more that we need to learn and in being able to treat these patients.
I like your eyes are like lighting up as you talk. So that's like cool to see that that's an exciting part for you. What does that look like when you get to interact with couples, or I guess you can't really share stories, but like, I guess like moments within that part, like that were more personal in like reminding yourself that this is where you're supposed to be, or this is the right field that you chose?
Yeah, I think really just appreciating every little thing and seeing how much of an impact or influence your communication and response to your patients has on each individual.
Does that make you feel pressured a lot when your words have so much power, or I guess not?
Yeah, not as much pressure, but I do feel like very lucky and special that I get to play this, this role. Yeah. To introduce them to other things that they never knew like were possible, or other options. I think starting a family it can be done in so many different ways. It doesn't mean just having like a child of your own, right. And then especially with now with like third-party reproduction, like surrogacy or same-sex couples who can't necessarily carry their own child. There are so many other ways and options that they have. And so, you know, I think whether it be like a patient undergoing IVF and when you're doing your egg retrieval and getting more eggs than you anticipated, you know, that in itself is like very exciting. And
Okay.
and then
I'm assuming good.
Yes, very, very good. And then obviously when patients come in and get their like pregnancy hormone test and we get a positive pregnancy test, that's always, I think every single individual who has that experience, it's a joy and an excitement for our entire team, not just the patient. And then, you know, even simple things like, for example, like patients with PCOS, like polycystic ovary syndrome, they don't know necessarily that they're not ovulating, but it can be a relatively simple thing to treat. So I had we were at our we have a endocrinology clinic at our county hospital at Bentob, and so we'll see infertility patients there, but we can't offer IVF. We can only offer like very limited things like medications with like timed intercourse. And so she had been trying to get pregnant for many years. We did the basic workup at our county hospital and we gave her a specific medication for PCOS patients. And she came back the next month and she was pregnant on her own, like just after the medication. Yeah. So just like those little victories, being able to provide hope and a future for these patients who didn't know or like would have never been able to experience
to imagine some people who had PCOS like years ago and just like on their own were like defeated, right?
Yes.
But then now there is this like open door to like have an option or like figure out what they can do with you. So that's like really exciting to be on that end. Wow.
Definitely.
Cool. So to clarify, as someone who's probably like me, even though I'm married to a doctor and have in-law doctors, but like if I'm like medically a noob, like what exactly is like REI day to day? Like you do IV, like it's anything, like a couple comes to you, shares, oh, we're struggling, and then you talk it through. So then you offer, like you said, IVF or certain words, acronyms or whatnot. Like,
yeah. So, you know, reproductive endocrinology and infertility. So reproductive endocrinology is kind of the evaluation and study of hormones related to fertility or reproduction. So historically in REI, it used to be much more endocrinology heavy when we didn't have all the IVF technology, when we weren't able to physically do IVF in the lab or have it be as efficient. So we technically are trained and capable of seeing endocrinology patients. So if patients have like thyroid abnormalities or a pituitary tumor that's affecting their reproduction, we technically are able and should treat that. So during fellowship, I am doing training and working with endocrinologists, pediatric endocrinologists. We also see like transgender patients and a lot of REI doctors will manage their hormones. So like estrogen and testosterone, they have that capability as well. So some people aren't even interested in getting pregnant. Some people just have some hormonal balance and want to be evaluated. And then some people that have PCOS who aren't trying to get pregnant, we also will manage that too. Yeah, because PCOS patients could go months to years without having like a period, and that's not that we would recommend further evaluation for that, because you can be at risk of other things. And then the infertility side, you know, we've definitely come a long way. So we don't actually, we as reproductive endocrinologists, most of us don't manage the actual like egg and sperm in the lab. We have a whole team. So we have embryologists that work in the lab, and we work very closely with them. The egg and sperm you cannot see with the naked eye, so all of it is done under the microscope. So day to day, you know, most of us will spend 3 to 4 days in clinic, and then the other portion we're doing procedures. So egg retrievals in IVF, intrauterine inseminations or IUI, which can be done in the office. And then further evaluation can include like hysterosalpingograms or HSGs, which is it's like It's like an X-ray dye test that like looks at your cavity and sees if your tubes are open. And so we really do all of that workup. So we'll do the entire workup, manage and treat the patient, and then like monitor all of their cycles. Yeah, so
there's
it's a lot. Yeah.
Do.
Typically the retrievals they're done first thing in the morning because they're very time sensitive. So patients are on their IVF medications, and then when you give them their trigger injection, we time it to where we do the retrieval about 36 hours after the trigger. So it's very time sensitive.
Yeah. When you finish fellowship, will you like then choose even in between RE or I, or is it like it'll just all be encompassing in your practice?
That's a good question. I think it depends on your comfort level of seeing endocrinology patients, because a lot of these fellowship programs are straying more away from endocrinology and more IVF. I am lucky in that I am, I work at Texas Children's at the Women's Pavilion, and so
that's where I think I delivered.
But it's a great hospital. And Texas Children's, if anything happens, to your baby, they have a high level NICU. So I think that's really important. But because it's an academic institution, we get referrals from not just in the city or state, but we see a lot of patients that are come from out of the country. And so we see a lot of very rare pathologies that come through. And then even working with like pediatric endocrinologists and adult endocrinologists, there's just a breadth of things that we see that I don't think most quote normal fellowships that aren't affiliated with the academic institution see on like a day-to-day basis. After that, I think whatever I decide to choose, or whatever someone when they finish fellowship chooses to pursue, I would say academic medicine probably offers more of a variety of patients, because typically, they're getting referrals from other places, and so they may see potentially more difficult cases. Whereas in private practice, they, I think, are leaning more towards or moving more towards doing more infertility things and less endocrinology things.
I see.
So I think you have that option to kind of cater your interests and your strengths into what you want your clinical practice to be.
Got it. Wow. I guess this is like question maybe that you could share with the listeners of like if there are any common misconceptions about infertility or like common advice you find yourself giving to, I wrote women, but like couples who are going through this struggle together.
I think a lot more women and couple now are, a lot more than previously, are choosing to get evaluated for infertility. Previously, a lot of women and couples, they were embarrassed. A lot of people thought infertility is a taboo, and they thought that something may be wrong with them. Women, I think, put a lot of blame on themselves that they weren't able to get pregnant. But really, we quote about like a third of infertility is unexplained. So we do a full evaluation, and everything that we can see on our standpoint comes back normal. A third is some sort of female cause, and then a third is about a male cause. So it's really, it's pretty evenly distributed. And so I think a lot of women don't know that. And so a lot of times they blame it on themselves. But people should know that, it's nobody's fault. You shouldn't be embarrassed about trying to get pregnant and not having any success. And that us as reproductive endocrinology and infertility specialists, we're here. This is like our job. Like we will not judge. And this is kind of a place of safety where you can open up and we can just get more information, whether you choose to pursue anything beyond that, but at least just provide information. I also think, a lot of couples, they first will see their general OBGYN, and there are certain specific recommendations, just national guidelines that we recommend. So waiting like 6 months to a year, depending on how long you've been trying. But I would say, everyone's timing is their own. So if you feel like you want to wait longer, or if you feel like you want to be seen sooner. So, let's say you've just been trying for a couple months, but you are feeling anxious and you want answers. I think that then would be a good time for you to see an infertility specialist. I think that a lot of times people put numbers and, you're tracking your ovulation and you're like, I'm ovulating now. Or if you're not ovulating at all, I think it's really just each person's own personal journey, and when they feel like they do or don't need to be evaluated, I think that's their time.
I want to kind of bring it back to what your dad had shared on his reservations of like starting a family, or like what that looks like and how that has been for you in the sense of being in this very competitive and demanding field, and then what that has looked like with maybe potentially in the future with your own hopes of that.
Yeah, I mean, I definitely, I think because family is so important to me,
Right.
I've always eventually wanted to have a family. As I've gone into this specialty, I think it's become more aware for me personally how like family building, how important that is, and how important it is to kind of evaluate and assess the situation. Just because I know that fertility preservation, or, if I'm not married and I'm single and I just want to freeze my eggs, that is becoming that is a viable option. Whereas, 5-10 years ago, we still considered it experimental, but now we consider that a routine viable option, not just for women that are just electively wanting to do it, but, for like cancer survivors or other patients who, let's say they're, for God forbid, like losing their ovaries or something, that definitely is an option for them. And also a lot of data recently has come out that female physicians are about twice as likely to suffer from infertility compared to the general population. Wow. So it's about 1 in 4 female physicians will suffer from infertility.
Because of the stress, or like?
I think a lot of women in medicine do prioritize their work.
Right.
So for me, example, when I was in residency, I didn't have a lot of time. Dating was not my priority. Like any free time that I had would be spent with my family and friends. And even now, I mean, it's a priority. Like I want to start a family, but still my priority is work.
Right.
So that I think has made me realize, I am considering freezing my eggs, especially, when I'm in fellowship and I have a little bit more time. And so that's something I think, being in this field, being a female in medicine, I think that's something that is important to me, being able to like make that decision for myself. And I mean, while it is, you have to have money to be able to pay for it, unfortunately. A lot of insurances like don't cover it. But I also, what I see, because I'm at Texas Children at Women's Pavilion, I see many female physicians who have to go through this.
Right.
And it's probably emphasized more because I'm at a medical center and I'm seeing all the physicians and stuff. But yeah, it's made me realize that, being in this position just has, made it more obvious to me that I probably need to be freezing my eggs.
Yeah, I just feel like that's a decision a lot of female physicians have to face. It's just like that crossroads of like the importance of this work and the amount of time that you've sacrificed into this field, and then like I guess what society tells us of a timeline with whatever that is. So I even hearing this makes me excited and glad that there are these options that are available.
Yeah, I mean, even if it's always like, of course it's always an option. Like I don't think like our in residency or fellowship, we're not going to tell you not to get pregnant, but our maternity leave is it's limited.
It's terrible. I worked with surgery residency. It's
yes. It's 6 weeks.
Yeah.
And being a trained OBGYN, pregnancy is something you cannot predict whatsoever. We can't tell you when you're going to go into labor. We can't tell you if you're going to deliver preterm. We can't tell you if you're going to need to get induced. So it really it's hard to plan. And being in medical school and residency, when you're continuously working these hours or studying for a certain board, it's hard to try and plan like a pregnancy. Obviously, if it happens, spontaneously, or if you're not expecting it, you have to just figure it out. But for me, I very much, and I'm sure a lot of other women, I'm very much a planner. And if I can plan it, my plan would be to start a family probably after I finish my training.
Do any of these resonate with you? Perfectionism, imposter syndrome, or burnout? I don't know if they do or not, but I was curious if any of those are like stick out.
Yeah. I mean, definitely definitely all of them do, but I definitely identify myself as being a perfectionist. Especially since I've started working with patients. Because, at work, I think that's what you should strive for, perfection, because any mistake could be detrimental to the care of patients. And so I think that's great to strive for that at work. Obviously, nobody is perfect, but I think if you strive for that, hopefully there isn't anything detrimental that you would miss. The struggle that I have had over the past few years, like since I've started residency, is having that mentality and that mindset at work. It's been hard for me to separate work from my personal life. So a lot of times I'll find myself, go, like trying to be very efficient and at work and trying to have everything quote perfect, and then in my own life finding myself trying to be perfect in every way, and like nobody is perfect, and everyone, you're gonna run into like struggles and issues, and honestly I just feel like it's given me more anxiety if anything. And so after finishing residence, like being in fellowship, I think it's really been a good time just because the hours are much better, and the pace is a lot slower than what residency was. It's really allowed me to self-reflect and try and separate the two, which I don't know if I'll ever be able to do, but at least make a mindful effort of trying to do that.
You're also Enneagram 3, which is like achiever. And I feel like a lot of achievers, like strive for perfection in what they do too. But anyways, I think that's interesting. The more I hear
Are those similar, ESTP?
I don't know if they're, because like I don't think there's an official like crossover or correlation between the two personality tests, but I feel like the descriptions of them seem like they fit well together. But I would say I think 3s are feelers. They're actually more like feeling based, but your ESTP means you're more logic based.
Oh, interesting.
And so that would be interesting if we did a whole nother episode on like just your personality and
personality
the clashes.
Trait,
That would be interesting because you seem to go through like logic and reasoning sometimes in the Myers-Briggs, like your behavior, but internally or intrinsically, you might be more like heart-based.
Yeah, actually that does kind of make sense because I do feel, and as I've been aging, I do feel like my personality, maybe certain traits are changing, but at work, I think that, my ESTP is very accurate. Like I am very, I strive to be, great at when I'm, when I'm doing my job and all of these things. But in my personal life, I do feel like I am more emotional and more of a feeler, and I think that also gives me the ability when I am at work to be more empathetic and compassionate towards my patients.
Taps in.
Yeah, which I think is important, especially in this field.
Yeah, interesting. Okay, to end the medical journey, what would be one final piece of advice you would give to either your past self or someone maybe like you going through this journey right now?
Well, we kind of discussed this earlier, but I think really embracing every moment that you're in. So even if you're going through something that you find very difficult, whether it be like going through a rotation during medical school that you're not necessarily passionate about, just remembering to be in the moment and really appreciate and take advantage of that situation and the people around you, because you will never again have that. And, any failures that you undergo, just keep in mind that everything does happen for a reason, and all these failures and accomplishments are going to contribute to your character and your life path, both personally and from a career standpoint.
Well, you're graduating next year.
Yeah,
finally.
I know.
I'm going to be so interested. I feel like, what are you going to do with yourself after you have this freedom?
Yeah, I'm interviewing for jobs right now. But the thing, it's like interesting. The thing is, it's not, interviewing for jobs and talking to my friends who are out, like, in some ways, going directly into private practice is more work than fellowship, because in fellowship, I feel like I have a lot of very protected time. I'm in the basic science research lab I'm in the midst of an 18 months like cycle. And I feel very supported. I have the guidance of like my researcher who has been doing this for many, many years, and he's very patient with me. So I'm a little bit nervous, but I am definitely excited.
I'm excited too. Before we wrap up, I guess just so our listeners can hear, I guess the flip side, all the things I feel like I get from you, which is like the personal side. And today I finally learned the medical side. What are some things that you feel like define you beyond your MD degree?
I think, identify myself in all aspects, like a daughter, a sister, a friend. I have a boyfriend, so I'm a girlfriend. Like, and besides being a doctor for my patients, I think all the things that I love. So, my family, my friends, enjoying my time outside of the hospital. I really enjoy like traveling and cooking and culturally just discovering other things that I've never been exposed to. But I think traveling is a great way to do that. And so, I definitely, while I take a lot of pride in my work, I try not to identify myself as just an REI doctor, but definitely, and hopefully one day identifying myself as a mother and a wife, that obviously is the ultimate goal. And then being able to teach my children what my parents taught me and ultimately leaving some sort of legacy.
That's cool. I think you do a good job of not letting this be the only thing that defines you or something. So I feel like that's something I'm taking away from today, from how I've gotten to know you.
It's definitely hard. But I also another huge thing I would say is my Christian faith. I grew up going to church with my parents. My parents have always been involved. They're still very involved in church. And medical school residency, it was really difficult to maintain physically going to church because I would work a lot most weekends. And then, it's difficult being around people who don't necessarily share the same faith. You sometimes become influenced by that. But I think remembering that there is a greater purpose, and my sole purpose in life and the afterlife is not to become a doctor. I think that actually takes away, I feel like a lot of the pressure, and really just makes being a doctor more enjoyable and less of a pressure to have to please everyone and to have some sort of outcome.
You're very good at putting things in perspective. So positive. I don't know if you have an answer to this one, but we'll see. If you could be a fruit, what would you be and why? If you don't have one, we can skip it.
Well, I love fruit. So that's I was I've thought about this before. I'm like, oh, what fruit would I be? Actually, a fruit that I discovered recently from my boyfriend, Chris, because he's Vietnamese. They like a lot of tropical fruits. I actually really identify with the dragon fruit.
Oh, okay.
Yeah,
why?
I've never... Because they're very, they're pink. So they're very vibrant on the outside. But then, you cut open the inside and it was very different than what I expected to be on the inside. I mean, obviously other than the pictures, but it's white and with the little black spots. So it's I'm more vibrant on the inside, but I can be more sweet and loving on the inside and soft. Sometimes I can come off a little bit aggressive and harsh, my family always says. Sometimes I can come off a little bit aggressive, but I think ultimately I think I am very loving and internally, like you were saying earlier, I like to feel
the heart. You have the heart
exactly inside.
See, now when we eat dragon fruit, we can think of Monica. Okay, I'm going to keep that question for future guests.
That's a good one.
All right, I think we will wrap it up here. Before we close, I'm going to play a quick superlatives game with just 10 quick questions where I say a question and you tell me which sister it is.
Okay. Ooh, I don't want to offend anyone.
Are you okay with this?
Yeah.
Which, by the way, we mentioned earlier. So you come from a household of 4 daughters. And it's Amy, Tiffany, and then you, all pretty much a year to a year and a half apart, it sounds like. Yes. And then Elizabeth, who's 6 years younger than you.
Yes.
And all of you guys are in the healthcare field, ultimately, which is all kind of nice.
Yeah, all in the healthcare field, but all different things.
So you guys just touched all the bases. There's Amy's a dentist, and then Tiffany's a pharmacist.
Yes.
You are a doctor, and then Elizabeth just graduated nursing?
She just graduated nursing school and just started working in Dallas. She's in Dallas.
Oh my gosh.
Yeah,
Do you want to end up in Dallas?
Potentially. Yeah.
Okay. Maybe we'll.
Yeah, I know. Maybe we'll both be. That's what I was thinking. That's what I was thinking. You'll be. Yeah, I'm. Okay. Yeah, mine will be in a year and a half.
Yeah. Well, I'll wait for you. Okay, so it's just 10 questions, and then I say it quickly, and then you just answer with the first name that pops to mind.
Okay.
Who's the favorite child?
Oh, that's a tough one. Maybe Amy. Oh, yeah. But my parents I have talked about this recently, but my parents like really don't show favoritism. I know your family is Alex.
Like they will die to the grave,
he's a boy,
right? And say no. But I mean, like, I
think we're all the favorites, but I think Amy holds a special place in the heart because she's the firstborn.
Who did the best in school?
Tiffany.
Okay. Who would be the most popular?
Me.
Who takes the longest to get ready?
Tiffany. But she's gotten much better. She's gotten much better.
How long are we talking?
Tiffany was always a tomboy growing up, which is interesting. She was always a tomboy, but then me and Amy, Elizabeth was still young, so she wasn't doing like hair and makeup and all that stuff, but I think we really like feminized her. So in college, she always took the longest.
Because she was like adjusting to that life?
I think she was like, she was like trying to do her like makeup and her hair, and so it would take her a little bit more time, but she's gotten much better now. We're all kind of on the same wavelength now.
Interesting. Who's most likely to be the one to call at 3 a.m. drunk?
Who? Elizabeth?
You. I guess you. I don't know.
Probably. Yeah, me too. Yeah, I would definitely.
No, I was saying, I guess call you.
Oh, yeah. I would also do that.
Yeah, I think I would be the one of my family. Who's the best athlete?
Elizabeth.
Yeah, she's pretty.
And good. I think, I would say either you or Alex.
Oh, of our family.
Yeah.
Yeah, I mean,
it's different.
My brother went to Harvard for soccer, you know, who can compete? But,
But other than soccer.
He has like a back problem now, so, we can get older, the ranks might change. Exactly. Who is most likely to be arrested?
Oh.
Everyone's good.
Yeah, everyone's good. Nobody.
Good. Your parents touch
Yeah.
Who has the best taste in music?
We all have different tastes. I think probably Elizabeth and Amy also has really good taste. My brother-in-law has really good taste in music. Amy's husband, Steve. Okay. He likes to collect records. Like she got him a record player.
To collect.
To collect. What? To collect records.
Clearly, I would not get this answer. Oh, okay.
And then Amy, she played piano, so she is. She's really into classical music and has a pretty good sense of music.
Did she learn from your mom?
She did not get piano lessons from my mom. My mom was like, absolutely not. But she did, I think, have like her introduction to piano was because of my mom.
I never knew your mom was a piano teacher.
Yeah, and she played piano for our church.
Oh, in Oregon or also in Pineri? I
don't think Pineri. Pineri, I think when she first came, like just like when they were absent. Yeah. But when she was in Houston, she played for the church in Houston. I think that's what my dad's parents, my dad and his parents liked about my mom. And then in Oregon too, she did play.
See. Who's most likely to laugh at the wrong moment?
Amy.
Oh,
yeah, she laughs. She just laughs at everything.
I only know. I think your laughter is like the best. But you also have like social IQ or whatever. I feel like you wouldn't laugh at the wrong moment. IQ. Yeah, that's true. But you have the funniest laugh.
Amy ever. I think she just thinks like Tiffany and I, when we were younger, Tiffany and I would have like laughing competitions. Like we would try and make her laugh. It was like a competition between, it was bizarre.
And then who would spend all their money on something like stupidly huge?
Probably me.
Yeah. I see.
I don't know if I'd ever have the willpower to do it, but out of all my sisters are like pretty financially, me or Elizabeth, I guess.
Interesting. Well, so you have it, the answers of the 4 Chung sisters. Anything else you want to share or leave behind before we sign off?
No, that was so much fun. I'm so glad we finally got to do that. I feel like, our parents are obviously friends for a reason, and I think our family background is similar, and just the fact that you have 3 children in your family and 4 children in mine, and we're of similar
ages. That's true.
So I'm glad we finally got to do this.
I feel like that's like as I listen to you, right? Like I think obviously your story is so unique and your journey is yours, just as every doctor's journey is their own. But I think like as I get to hear, it's like realizing the connections we have and like even being able to resonate with like, parents who did instill faith and how that still, even when we go through our ups and downs and we stray away and like it's hard to stay in, like me personally, I think that's also like a connection. And then
definitely.
I had a quick question. Sorry. When you were growing up in Oregon and it was like very small Asian community or Korean community / Asian community, like how was that for you? Like, do you think that helped you to like not assimilate, but like be comfortable with all races, or like is that something you feel like you wished was different? Because I feel like for me, like I grew up in Dallas where it was very not at school. Like, it was diverse and also cliquey based on race at school. But like I had this huge Korean community that I felt like fed into my identity a lot. And also something I always crave because I feel like I didn't separate that. But I'm curious like what that would have been like since you were like in Oregon, which I feel like I didn't hear about that state till later.
Exactly. What I'm really grateful for, I think, so what I wasn't grateful for when I was younger, but within Oregon, just like it would be like from Plano to Frisco, like we would move from like every few years. My parents would decide that my mom was like, oh, I love this house, like let me move here, and she built a house like in Tualatin, which is ultimately where I went to high school. And so I was moving schools like every 3 to 4 years, and so like from elementary to middle school to high school I had to switch schools. And so I think even culturally, but also just the fact that I had to adapt like very quickly and meet all these people and be able to try and relate to them and mesh in. And, I am a very social person, so I wanted a lot of friends. And so I think that really helped me to develop confidence and be able and adaptability. But I think that, for a long time, obviously I'm Korean American, but sometimes I think being in a predominantly non-Asian society did sometimes make me not appreciate my heritage as much because I saw all my peers around me and, they have blonde hair, blue eyes, or like brown hair, and they just didn't look like me. And so I think I saw that sometimes as a negative, and that I wanted to be like these other people around me. And like, their families come from completely different places. Like when people come to my house, there'd be like kimchi in the fridge. Right. That they had never. Now kimchi is like Korean.
It's trending.
Korean culture right now is trending, which is so wild to me. Like people are like, there's kimchi at like Central Market or Whole Foods, and like that was never like a popular thing. Like when when we were growing up, and so. I think sometimes I would be embarrassed about that. But obviously now, like looking back, I realize that, it's just something to like embrace rather than to be ashamed about.
Yeah. I feel like that's a really good perspective. I feel like it helped with your empathy too, or like being able, like you're saying, adaptability, and then the empathy strength you were sharing too. But anyways, I was curious about that since, that's a connection we don't share in how like like the place or location we grew up. So.
That's true. True.
Okay, I'm done. Thanks, Monica, for joining in. We're excited to celebrate you next year when you officially graduate.
Yay! Yeah, and you can have me back anytime.
Yeah, and kind of see what other reflections you might have, or share about all the other amazing things you've also done that are not just your doctorness.
Yeah.
All right.
Okay, well, thanks, Angie.
Thank you. Thanks for listening to Color Commentary. Wow, I loved getting to sit down with Monica and share a conversation over things I never took the time to ask about. For some, this could sound like a typical model minority story, but the reality is that a lot of us carry this identity in following a career in healthcare or even in law. Whether it was to simply achieve the dream for our immigrant parents, or like Monica's passion to discover what she's fully capable of, I want to take the time to celebrate the many of you who have taken this long route in your professional path. I know these years have been very long and difficult, but what you are doing is so admirable, and I hope you can find nuggets of hope and inspiration in Monica's story, just like I did. And here's a special shout out to the women of color who are breaking barriers and redefining what's possible for us in this world. We appreciate the sacrifices you have made and the obstacles you have faced. You are my hero, and happy Women's History Month. If you love this episode as much as I did, head on over and rate and subscribe so you never have to miss another. Go to @ColorCommentary to comment your key takeaways and join the email list to share what you would like to hear about next. This is Eunji Kohler signing off for today. See you next time.